Hello, my name is Lisa Higgins. I'm a VODA-trained lymphatic drainage therapist and medical intuitive. Today I'm going to talk to you about how to clear your arms if you have had some sort of damage to your axilla, your armpit, whether that's through cancer treatment or trauma of any sort. I'm going to show you how to open up your lymph nodes and drain fluid away from the affected side. So for today's video, I'm going to pretend that I've got lymphoedema on this arm and I've got my comfy wave on here to act as a visual. Now, all lymphatic drainage, we always start up in the neck because this is where your lymphatics pour into your vascular supply. So it's one of the most important places. We need to open this before we open any other part of our lymphatics. And how I do that is I cross my arms over and I come into this little triangle here. If you squidge forward, you see that there's an indent. So if you relax and you're using two flat fingers and you are making 10 little circles, very slow, very gentle, stretching the skin. Just 10 like that. Stretching skin, because your lymphatics are actually really close to the surface of your skin, so you never want to go down too deeply and you never want to be digging in. Everything with your lymphatic work needs to be gentle. So because I'm using this as my affected side, what the aim is to move fluid away from the affected armpit. Now, back when I was first taught how to do all of my lymphatic work, we were taught to create pathways coming across the chest to the other armpit and down into the inguinal, because that's what we thought would be taking all the fluid away, all the pressure off. But the latest testing using ICG imaging, the indocyanine green imaging, shows that over 70% of women or breast cancer related lymphedema still flows into the affected armpit, which is mind-blowing. So with that statistic, we've started sending some fluid into the armpit, but also a large number come over the top of the arm, over the top of the shoulder, and come across the chest. So they've found that there's still a lot of flow across the chest onto the other side. But what they found is this pathway here that we've been encouraging, there isn't very much evidence that fluid flows down here. Now, just because there's no evidence, it doesn't mean that it doesn't flow that way for you, because bodies are all individual, and for you, it may come down into your groin area. If you've noticed that that works for you, you keep doing that. But we've kind of changed how we treat and how we ask you to do your lymphatic work. So after opening the lymph nodes in your neck, we then come across to the unaffected side, and I use this part of the hand. I don't use my fingers, because if you use your fingers, you do this and you're digging in. But if you use this part of your hand, you're getting the right spot and you're doing it correctly. So right where the hair grows out of your armpit, you're going to do 10 little circles. And it doesn't matter which way. One way feels natural to you and the other way just feels awkward. So whichever way feels right to you, that's the way you're going to do. So 10 little circles to open up this armpit. Now, then we're going to do the belly breathing, because there's evidence that shows 5 abdominal diaphragmatic breaths 5 times a day helps to control lymphedema. Now, if you can breathe properly, that's great. So if you look at my hands, when I breathe in, breathe out. So most people struggle with that. There's a cheats way of doing it. So what we do is bring the arms between the chest, and you're going to breathe in and move at the same time. So breathe in, breathe out. And by incorporating that movement, your diaphragm actually moves. Even if you can't feel it, it is moving, and that's creating a high pressure system in your abdomen where over 50% of your lymph nodes are. So your deep abdominal lymphatics are getting stimulated and getting that whole lymphatic pump working. So you've opened up the neck, you've opened up the opposite armpit, you've opened up the abdomen. You can open up the groin as well. That's going to be great. So you can either just do some leg lifts, or you can do some circles at the top of your leg, just at the panty line. Once you've opened all of those up, what you're going to do is you're going to create a pathway away from the affected side. And so to do that, you're coming from the affected side and you're stroking across the whole chest area, almost trying to bring fluid to the other side. Now, it's not just one band, it's the whole way across, so the underneath, right over the top, and above as well. So you're just creating this wonderful pathway away. Now, another thing you can do is, and I turn people on their side so I can clear their back, you can actually get a dry brush and create that pathway along your back as well. Or you can do it this way, just because a lot of people get a buildup of fluid here, so we want to get that moving. So you can do it that way. Using the brush across your breast is probably a little bit tender. Once you've created that pathway, and then again, if you wanted to come down here, if that pathway works for you, knock yourself out. Then you're going to start with the arm, and you're still not going to send everything here. You're going to send it lots of different ways. So you can just stroke. You start with the top part of the arm. Obviously, you're going to be taking the sleeve off. In fact, let's just do that so we don't add to the confusion. So you're going to move fluid very gently, and it's like you're stroking a cat. It's a really gentle movement towards the armpit, but also you're going to come up the top and you're going to bring it over the shoulder. Remember I said a lot of people flow over here. And you can take it even more technical if you imagine a line between your elbow and your armpit and the top of your elbow here and your shoulder. Imagine those two lines. And what you're doing is you're moving fluid from one line to the next. And you work your way down. You can come from behind as well. And you can use the brush to do that as well, if that's easier, because the brush gives you the right pressure. So you're just going to bring it up to that midline, and then you're going to take it up and over into that point here that's so important. Then you're going to come down and you're going to do the bottom half of your arm and into your hand. And then clearing the top half quickly again, pathway across, and you can do the back again, down again to finish. Now, if you've had lymph nodes removed from both armpits, it's a little bit more tricky, so I'll just do that very quickly. So what you're doing is you're stroking upwards into these collectors here. So you're doing upwards, and you will do some downwards, because we don't know which pathway your body has chosen to take. So we open everything up. So on both sides, you're doing upwards and downwards, because you don't want to send it to either side because you've had lymph nodes removed. Hopefully you're one of the 70% who's still flowing into that armpit anyway, but we're just going to try and relieve as much pressure as we possibly can. And then you're going to do the same thing on this side as we did on the other. You know, the coming like this, and then up the outside. You can bring some in here, the lower arm, and the hands. Now the back you can also do as well, you know, just to sort of make sure, and you'd be bringing the back up like we did in the front. You're doing the same thing and bringing it down here. Hopefully that's given you some ideas of how you can do some work for yourself at home in between your visits to your lymphedema therapist, and give you some autonomy over, if you notice that things are swelling up, then you can take some action and reduce the swelling yourself by doing your own clearing and wearing your compression. Hope that helps. Talk to you again soon.